In today's video, we're going to be talking about the types of networks. An HMO stands for Health Maintenance Organization, and coverage is restricted to a particular network of doctors and physicians. A PPO is short for Preferred Provider Organization and allows patients to choose any physician they wish, either inside or outside of their network. The biggest difference between an HMO and PPO is that patients in an HMO must first see their primary care physician, who will refer them to an in-network specialist for certain services. With a PPO, you can see specialists without a referral. With an HMO, you must stay within your network of providers to receive coverage. Under a PPO, patients still have a network of providers, but they aren't restricted to seeing just those physicians. You have the freedom to visit any healthcare provider you wish. Generally, if you go to an out-of-network provider, your copays, deductibles, and coinsurance will be higher.